Well, we might get started. Good evening, everyone, and thank you so much for joining us tonight for this exciting event from Brisbane North PHN. We're presenting a What's Next for Primary Sense and utilising for your CPD hours. My name is Claudia Savage and I'm the project lead here at Brisbane. The purpose of tonight's webinar is to inform, educate and support general practice in our region to use primary sense to assist with your CPD hours. We will specifically be deep diving into your CPD hours and we'll be doing a mini and full clinical audit. Understanding that the tool is still in its infancy, we want to help integrate primary sense into your daily practice, help encourage where appropriate a whole practice approach, and it not to be an extra item on your to-do list. So we'll just jump into some housekeeping. I'd like to start with just saying that when we have questions throughout the chat, all questions will be answered at the end of the webinar. We do have a designated Q&A section after our presenters are finished. Please add them into the Q&A section and we'll answer them. However, if they do not get answered on in tonight's presentation, or we're not the experts and not able to answer them, what we will do is we'll find and send it out in the form of an FAQ resource. This webinar tonight will be going for 60 minutes. It is recorded, and for those who have registered but were not able to attend, the recording will be made available. Once the webinar has finished, an evaluation survey will pop up on your screen. We do highly recommend and encourage you to fill it out because it helps us to tailor and improve from tonight's information session so we can make it better for you and moving in the future. Our slides and any related resources and tonight's FAQ will be sent out, but please note that this can take up to 2 weeks. And lastly, right at the end, we do have a QR code which links to a pre-filled quick log for your CPD hours, so you can do it there and then. So before we do get started for tonight's webinar, I'd like to pay an acknowledgement of country. I'd like to acknowledge the traditional custodians of the land in which we're meeting, and across Brisbane North there are many regions. We acknowledge the waterways, the land and the sky and all of those who inhabit this place. We acknowledge their ancestors and elders and recognise those who continue to protect and promote Aboriginal and Torres Strait Islander cultures. We acknowledge the past and we stand together for the future. So tonight, it is really exciting. We have 2 presenters. We have Juliet Schaefer, who is the RACGP CPD Coordinator for Queensland. And then we have Dr. Kylie Norris, who is a general practitioner within our region, and she is also a general, a GP liaison officer here at Brisbane North PHN. So tonight, what we will be going through is we've done the introduction. Then I'll hand over to Juliet, who will be doing all things and discussing all things with CPD. Then we'll hand over to Dr. Kylie Norris, who will be showing you how to do a clinical audit. Then our QI&D team members here at Brisbane North will be doing a live demo of how Primary Sense can support the clinical audits. Then we'll move on to the Q&A section, and then we'll conclude for tonight's event. So now I'd like to hand over to Juliet, who will be talking all things CPD hours. Thank you so much, Juliet.
Thank you, Claudia, and welcome everyone. And so yes, I'm here to talk about measuring outcomes today, and I am one of the CPD program coordinators here in Queensland. So I may have spoken to some of you at some stage over the last year or 2. So just to give a bit of a refresher about the changes to CPD that have occurred from the 1st of January of this year. So just to go back, so we GPs and all medical practitioners need to do 50 hours a year of CPD. There is a PDP or a professional development plan, which is a mandatory component of the 50 hours and the CPD program. There are program level requirements, and CPR is a once in a 3-year requirement for the college. That's our specialist high level requirement. You might have heard the terms of the different CPD activity types, being educational activities, reviewing performance, and today's starring role being the measuring outcomes. And yeah, so that's what we're going to talk about today. So hopefully none of that's too much of a surprise to people, as this training is, this annual year is coming to a close in very few weeks. So just to recap, those 50 hours are broken down into 3 different activity types, and there are minimum requirements for each of those. So educational activities, we need 12.5 hours over the year. We need 25 hours of measuring outcomes and reviewing performance over the year, and there needs to be a minimum of 5 hours of each of those. And there's 12.5 hours in which those can be completed in any of those 3 CPD types. And that's just a fancy chart. Okay, so in consultation with the team, we were looking at measuring outcomes and wanting to kind of clarify what that is and where it sits, especially in relation to reviewing performance. So measuring outcomes is really about using data to improve patient outcomes. And it could be clinical data, it can be practice data. Any kind of data at all is fine. And what is done is that, you know, we're asking you, or the MBA is asking medical practitioners to kind of use objective data to measure against the best practice standard or guideline in relation to whatever it is that you're looking at, and comparing where you are with ideally where you will be or should be in relation to that illness or disease or practice systems requirement. Anything that is related to general practice, you can, of course, measure the outcomes of. Okay, and of course, you do need to do 5 hours annually per year. So the distinction between measuring outcomes and reviewing performance is, I said, how measuring outcomes uses work data, whereas reviewing performance, I guess, is a bit of a precursor to measuring outcomes. So reviewing performance where you reflect or on your ability or on feedback that you've received about your work, and it might validate what you're already doing, or it might identify areas where you need to make some improvements. And it might be that next step of where you're making the improvement, where you kind of are going to transition from a reviewing performance kind of activity into a measuring outcomes activity. And maybe that's where that kind of distinction lies. So to ensure your reflection on your performance is best placed to improve patient outcomes in a real sense, then you kind of leverage your work data to make that happen. Okay, so kind of quality assurance activities should be based on your practice's own information and data, or of course from sources such as primary sense. So making quality improvement to your practice structures and systems and your clinical care that are based on practices information and data is designed, obviously, to lead to improved patient safety and care. So reviewing performance is primarily focused on the practitioner's practice, whereas measuring outcomes is primarily focused on the impact of that on patients in a way that is measurable and objective. So the 2 CPD types are linked. As I said, RP is often the precursor to MO, where the reflection kind of identifies changes that need to be made. So, you know, you might find that, you know, you kind of do an audit, for instance, like Kylie's going to discuss later on, and you find that perhaps what you're doing is already very good and meets, you know, the best practice guidelines. Arguably, there's always maybe a little tweak you can make or something that can be improved. But even if you're kind of, you know, your audit shows that you're doing the right thing, it's always just a really good idea to be, I guess, to have that confirmed. And that's always a good thing to do for your own practice. So here's some example measuring outcomes activities that are either based in on clinical data or in your practice, and other things that aren't quite so directly related, and I'll let you read those as well. So really the kind of things you are doing is improving the day-to-day operations of your practice. So you might be looking at appointment scheduling, record keeping, your software practices, recall and reminder system, reacting to patient feedback or complaints, for instance. Could be updating patient resources to facilitate improved health literacy. So you might have noticed that, people aren't really getting the sun-safe message, and so you're going to update and provide resources on skin cancer and preventative ideas. It could be responding to suggestions to people in your team, your practice nurse or other people. Could be auditing clinical databases, such as using primary sense to identify improvements that you can make. Also analysing near misses and errors and any adverse events are a good way, albeit perhaps too late in some instances, but a good way of just making sure that negative consequences don't happen again, and reviewing processes to make sure that is an improvement from now on. So many GPs have completed their minimum measuring outcomes hours by doing an activity created by the college or by one of our providers in the CPD provider network. And you can find those on the browse option on our My CPD. So if you go to My CPD, there is a browse option, and you can search in the search bar for whatever you like. So, for instance, there are a few providers that do cervical screening, skin cancer, excision type things, and so you can type that in here, or you can use the filter here and tick measuring outcomes, and there are that many activities that have measuring outcomes hours included. So that's not solely measuring outcomes hours necessarily, but certainly that there is a component of measuring outcomes. And when you come to an activity, you can click on it and it will tell you exactly how many measuring outcomes hours it will give you, which is useful. And so that's a really useful thing to do because it gives you exactly how many MO hours you're going to get. All activities that appear here on the browse function have been quality assured and checked by people like me in Queensland and around the country. So it's it's a better, I guess, assurance of quality as well. And the other benefit is that anyone that you find, any activities that you find through browse, they are providers of ours and they've undertaken to upload the hours on your behalf. And so it's not something that you need to worry about. You do the activity and within 30 days, those hours will be uploaded to your My CPD history. That's how you can find that. And that's one example of an audit that you can do in our, through our browse system. So there are many reasons to complete a measuring outcomes activity. Obviously it's, or, being able to do one where you self-direct, say like Kylie has done, and is obviously about to show us today, is that you can make it fit to what you need it to do. So if you have a specific interest in skin cancer or women's health or hemochromatosis or kidney disease or anything at all, you're able to tailor that audit to whatever is relevant to your scope of practice. And there are many options and resources available on our website that you can use as a way of guiding your particular activity, and kind of templates for documents that you can use to complete your activity and to upload as evidence. Here we have we know that measuring outcomes has been probably for GPs, I guess the one of the three requirements that they're feeling less comfortable with undertaking and are less sure about what to do. So to that end, we created a flyer here in the various types of practice you might be, whether you're a full-time GP, part-time, locum, etc. If you're in a clinical setting or non-clinical setting, we have a flyer that will help give you ideas on topics that you might include in your audit if that was something that you were keen to do. And because we know it can be hard to, access the data or to have the time, we are saying that if you have a minimum of 5 patients and you do an audit, a mini audit, like Kylie will show you a bit later on, you're able to claim 6 hours of measuring outcomes, and you can record that on your My CPD history. We've also provided, because CPD has been a big change, but it's also actually made achieving CPD considerably easier and I guess more flexible. It's just a bit of a mind shift change from previous training, that you can now actually record a lot of CPD, the things that you're actually already doing, which is a really good thing when GPs are already considerably overworked. So this is also a flyer of things that you do in your practice, like practice meetings, peer group learning, case reviews, audits, etc., and the kind of the activity type in which you would record that activity. And essentially, now that it's in hours, it's hour for hour. Essentially, if however long you took to do that practice meeting is how long you would record that practice meeting for. And so they can it's just a guide about how you might record those things, and a good prompt for that. The things you're already doing in practice, can be actually recorded as CPD. And there is a good list here of measuring outcomes type activities too, which is super helpful. Here we have the different resources you can access from our resources page on My CPD. So in a minute, Kylie will show you that she's used the template from our website to do her audit. And here's where she probably would have retrieved that from. And she can also do plan, do, study, act, events, practice meetings, etc. So for the most part, if there's something that you're keen to do, we should hopefully have a template here to assist you to do that. So there is a way of being able to claim measuring outcomes without doing a full audit. And so in the last few months, we've introduced a measuring outcomes tool, as well as a reviewing performance tool. But the measuring outcomes tool allows you to record, I guess, the measuring outcomes or the quality improvement actions that you take perhaps a little bit more incidentally. So, for example, let's say you've attended a course on hemochromatosis, for example, and you've done an educational activity, you've been to a webinar, or you've done a workshop with an organisation. Now, you might have identified by attending that activity that there are things that you're not necessarily doing in your practice that if you start doing it will improve patient outcomes. So you can go to that MO tool and follow the prompts, fill in the text boxes, and it will ask you to answer certain questions and be able to monitor your progress in changing outcomes for your patients with hemochromatosis. And you might record that for an hour or two. So it's a good way to kind of incrementally increase those measuring outcomes hours. So here's an example of how you might use, doing MO to improve your practice using patient feedback. So say, for example, it's a busy day and you've run late and 10 patients have complained about the wait time and a couple of them have left the practice in a huff because they haven't been seen or they haven't got time, and so you haven't been able to see them. So because you're obviously not wanting to, keep your patients waiting, or because you want to make sure everyone who wants to be seen is seen, you might review your consultation notes over the last 2 weeks and average how long is spent in a standard consultation, or you could ask your practice manager for a list of patient waiting times just to get a feel for it. There's an article you could read on 10 tips for becoming a Time Lord in an AJGP article. You might reflect on where you're kind of where you're falling down, I guess, or not meeting those kind of Time Lord standards. So you might decide, right, I'm going to create some autofill shortcuts in my practice software. I'm going to add an extra do not book appointment in a day so I can always catch up on my paperwork then if I need to. And I might allocate 2 patients a day for walk-ins so that you're not, being too pushed for time. That way you might then be able to log 2 hours of measuring outcomes CPD using the measuring outcomes tool. So it doesn't have to be a big thing. It can be an incidental thing that you're doing in your practice as well. So that's my very quick tour of measuring outcomes. And of course, if there's ever any questions, you can certainly ask in the Q&A. If you haven't yet, you are able to use the QR codes to download the app. I think the current number is about 90% of our members have downloaded the app, which is fabulous. So that's an option to do that as well. Otherwise, I'm able to hand over to Dr. Norris. Thanks, Kylie.
Thank you, Juliet. Yes, so Kylie Norris, as mentioned. So in August, as part of the GPLO program for Metro North, we actually hosted a diabetes education evening for GPs. We invited the Brisbane North PHN Primary Sense team to present a session on that evening in using the Primary Sense tool to perform a mini audit and an audit. So I decided after that session to try one at our practice. So yes, my CPD home is RACGP, and they do have excellent resources. So I did use the mini audit template that's available on the website there. So step one of the audit is to identify a need or a topic. So I chose to identify my active patients with diabetes type 2. And to check that they had a HbA1c and a microalbumin reading within the last 12 months. Going on the standard that RACGP guidelines aim for 100% of all patients to reach this target. Data was to be collected using the Primary Sense tool. So I sat down with my practice manager, Lee, and we did this one together. So this is what the Primary Sense report looked like, which we have de-identified. It contains quite a lot of information of patients that were under my care and classified with diabetes type 2 as a coded diagnosis. So it included HbA1c, urinary albumin values, when they were actually recorded. There were blood pressure measurements, ATSI status, influenza vaccination status as well. It also records when the patient was last seen at the practice and if they have any upcoming appointments. So what I first noticed was that there was quite a number of patients that were listed under my name that were no longer regular patients of the practice. Some of these might have been just visiting patients. Some were just here seen at the practice for the COVID vaccination period. Alarmingly, some had been transferred up to 3 years ago, and we had not done anything about that. So I was able to go through this list and give a list to reception to mark some of those patients that in those categories as inactive. So after completing a data clean, I could then analyse the data, read how many of the remaining active patients and their HbA1c and their urinary albumin status for those patients, if that was done within the last 12 months. The patients with out-of-date values were identified. I then recruited one of our practice nurses who sent a non-urgent recall to those patients, those relevant patients. So it certainly was a real team effort. Oops, I've missed one. There we go. So yes, did I miss another one? No, that was it. Sorry. So the learning outcomes with this, one of the unexpected finds was, no, I've got them out of order. There it is, I think. An unexpected find certainly was that when I was doing the audit, that I really need to be starting to keep my patient lists up to date, especially if I'm transferring notes. I need to be marking those patients as inactive. We also did identify a few patients who were not complying, and this includes me as well, that I wasn't complying with best practice. So we need to manage their diabetes from both doctor and patient, and they would benefit from a prompt via a recall system. So that basically completed the mini audit section. I'll just go back then to the next one. So then 3 months later, we did a re-audit of, so this was with Lee and I, the practice manager. So we just basically repeating the same search through Primary Sense. So active type 2 diabetic patients that belong to me. And certainly the repeat search demonstrated improvement. So we actually called it 100% because there was 2 patients that didn't comply, and looking at them again, one wasn't an active patient and one actually was coded as a diabetic and actually wasn't a diabetic. That basically meant we had to do a bit more of a data clean, and we put it down to 100% then. So I'll just go to, so then with the audit, we have to repeat the steps from step 3, and so certainly to sustain improvement, what we've now done is I've basically identified all of my type 2 diabetic patients, and the nurses have placed a recall in for 12 months for which basically says diabetes review. So if I haven't seen them and done this within 12 months, they will be flagged. If I do it beyond the 12 months, I push that recall out for another 12 months. So in summary, I found that performing the audit was quite a simple process to get the data through Primary Sense, and it certainly was a useful learning exercise for me. So using Primary Sense for audit purposes is a very efficient tool to analyse patient data, and certainly quite, it certainly doesn't take that long as well. But me being not particularly that good at my practice or my computer skills, I was certainly grateful for the assistance that I received from the practice manager, the nurses and the receptionists. And I really feel that that teamwork enabled the positive outcomes of the audit. So that ends my presentation, and I'll now hand over to the Primary Sense team.
Thanks so much, Kylie. That was fantastic. We'll hand over to Kim, who will be doing a demonstration of Primary Sense.
Thank you, Claudia. So for tonight, we've decided to focus on the report side of Primary Sense, this being the area where you will be able to obtain the evidence required at the completion of your clinical audits or mini audits. This information can be then de-identified for your practice. Can be de-identified for your submission of evidence to your CPD home. So firstly, we'll start off with the report section of the diabetes mellitus, which is what Dr. Kylie Norris used for her audits and mini audits. And as you can see, Primary Sense is a very simple tool to use. It's a double click and up comes your report. Now, in the diabetes mellitus report, there is 3 portions of this report. It is patients who may require HbA1c test and patients who may need a clinical review for a diagnosis of diabetes. The third portion is the portion that Dr. Kyler used, and that's patients with diabetes who may be eligible for chronic care occasions of service. As you can see here, the report is quite searchable in itself on the Google Chrome platform. You could also print by right-clicking and printing, or you could export to Excel, which is what I've done here previously. This is what you'll see when the Excel file pops up, and you can then edit your Excel file. So we'll enable editing. We will start a filter line, so you can filter your data down further than what you can in Primary Sense. So as you can see here, because we're coming up to the My Medicare registration, sorry, cannot everybody, I'll just make sure that you can see my screen. Sorry, I just put this over to the Excel spreadsheet in which we are working. So as you can see, the ACG score, which is the Adjusted Clinical Grouping Score of the Johns Hopkins guidance for the patient demographic, can be toggled through, and this can be utilised in your My Medicare registration that's coming up in as of July 2024, to select all of your patients with a higher category of ACG, and then you can filter out to that with all your diabetic patients with a higher risk score. Additionally, you can filter through to all of your patients who haven't had a blood pressure recording completed. And this then will show you who needs to be focused on at their next visit. So your nurse can then concentrate on all these patients who have not had a blood pressure recording. Now, this is demo data, so none of the patients on this file have had a blood pressure recording recorded. But if you were doing this in your real practice data, you would be able to filter through to see patients who have not had a blood pressure recording and have within a certain timeline. And then your nurse as a whole of practice approach to your clinical audit could assist by implementing a process change to complete a blood pressure recording at that patient's next appointment. Also, in this report, you can filter through flu vaccinations, so you can filter through to the patients who haven't had it done in the last 2 to 3 years and concentrate on that as well. So that's how you would use Excel for filtering out the data more precisely for your needs. So going back to the reports that are in Primary Sense, with the Primary Sense reports, we now can go through, as I mentioned before, with the My Medicare process coming up shortly, we can look at our high complexity patients. We can run a report on that and give your practice as a whole of practice a clinical audit to complete from the time the patients arrive to the time the patients go in to see your nurse for chronic disease management, and then through to the GP. The clinical audits can be based solely by the GP, or it can be a whole of practice. The next one I would like to focus on as a whole of practice approach would be your patients that are missing PIP-QI measures that have appointments booked in the next 2 weeks. So as I said, this is demo data. So at the moment, there is no data in this report. But what you could do in a practice, as a whole of practice, start with reception and focus onto the ethnicity recordings for your patients as they come in, and have your reception focus for each patient who doesn't have this recorded on their file at their visit that's booked, that you'll be able to see up in this report. Again, this also works through to the nurses, so they could also implement a process change where these patients who don't have the waste recordings can be focused on as they attend their appointments. Also the allergy status recordings and flu vaccines. Now, as we are coming in to the peak of the COVID summer wave, apparently, there is a winter wellness report that can be ran through Primary Sense as well. This will indicate the patients that have data in their files around their last COVID vaccination in your clinic and the number of vaccines, COVID vaccines they've had. This will then allow the practice to focus on the patients who are needing a COVID vaccine, and if they have an existing appointment, they can be focused on as they come into practice. So as my role is Primary Health Network, I am a COVID-19 support officer to help patients and clinics work around the COVID vaccines and support them as much as possible in getting those vaccines completed. So I think with these reports as well, when you're focusing on the evidence for your reports, these reports are saved once they're ran initially, and they're saved on the desktop into which the report is run. If you go through to your documents file and go to the Primary Sense folder, you'll see another 2 folders with reports or CQI. In those reports, there'll be listed reports that have been run on the days that you start your mini audits or audits, and then for the days that you run at the completion of your audit. So the data can then be filtered out through Excel, de-identified, and then uploaded through to your CPD home as evidence for the completion of your audit and mini audit. I'm going to throw over to Michelle. I do believe we have some Q&A, and I'll move on to back to the program.
Thank you, Kim.
No problem.
I'm Michelle. Hello, everyone. I think our presenters tonight have been so succinct. There is actually only a few questions. Kylie, there was a question to you in regards, did you share your audit with the other GPs in your clinic?
I didn't show them I suppose the Primary Sense details of it, but I think as GPs at the moment, it being the first year of this the new system, there's quite a lot of panic out there, unfortunately, and I actually do know a couple of my colleagues that are certainly getting quite nervous about the end of the year coming up. So I've just had some informal discussions about them, and I did also mention too that it was just something that I got some great assistance from our practice manager to do this too. So I do. I'm pretty keen to, I suppose, support the team approach with it. So if there are practice managers out there, just even offering to demonstrate this to some of the GPs, because they certainly may be in the same situation that some of my colleagues are in. I have shown the GPLO group because they're the main ones that we were discussing about the presentation today. And look, I think the other thing too is that it could be something that is fairly simple, and it's really interesting actually, just with some of the discussion we've had there, Kim, with what you've been showing, because we were seeing in our appointment books, there'd be things written about, do blood pressure, do weights and things like that. And I was thinking, where on earth is this coming from? So our nurses are actually using this, and I think that with the assistance of the practice manager to get to PIP-QI, I suppose, better standards. And something like that could even be quite a simple audit, though, too, about how many patients in my cohort don't have a blood pressure reading, and seeing if in a couple of months down the track that has improved. Or the other thing is a mini audit. So even if you're just doing a snapshot, especially at this time of the year, you could certainly get that 6 points of measuring outcomes by completing a mini audit within the next couple of weeks. So yes, I should. I'm certainly singing the praises to some of my colleagues, because, as I said, I think it's something that's fairly simple, and the data is there to measure the outcomes.
That's right, Kylie. It's an audit doesn't need to be something that is a big, long, drawn out audit. It could be based over 4 to 3 weeks. It could be based on 15 to 20 patients. Just as long as you're seeing that improvement with your data is the main objective, and improving your patient outcomes is what we're looking at here, isn't it, Kylie?
Well, Kylie, you actually mentioned the other day when we were having a conversation about the report in Primary Sense about the pregnancy and vaccinations, and you made comment, if you'd like to.
Oh, yeah. So as I was mentioning, one of the things that I was pretty astounded about was the number of inactive patients that we had. We were a group practice of 9 doctors, and so often they might be seeing, you have your own cohort, but there's certainly a pool that sees quite a few. And I was just thinking, from the PIP-QI audit, which would be pregnancy and flu vaxes, I'm sure our practice would have quite a number of patients that are still pregnant 2.5 years down the track. So I think, again, it is demonstrating that your data needs to be, even your practice information just needs to be updated. That pregnancy needs to be ended. We need to know whether they're breastfeeding and things like that. So I think that, and maybe when you're just kind of having an audit to reflect on pregnancy and flu vaxes, you are actually sitting down and doing a bit of a tidy up. And these things are all, I think, very important, especially leading into PIP-QI and for My Medicare that's coming. And perhaps it's also a way of getting the whole practice on board to do these simple little tasks to help for the the improvement of the practice data.
Thank you, Kylie. Claudia, did you want to say anything else at this stage? Because we have no questions. As I said, the presenters were so succinct, all's been answered.
Certainly. So what I can do is I'll just go back a slide. Oh.
Sorry.
That's okay. Wonderful. So I thought I'd just take an opportunity to introduce the engagement part of the primary care team here at Brisbane North PHN. I'll start on the left. So you've got myself there, and I'm the project coordinator here for Primary Sense. And then we've got Jo Lynn, who is the engagement team leader for the primary care team. And then on the right, you can see we have our quality improvement and development officers. So these, this team, they currently support all of the practices in our region for CQI, so continuous quality improvement and development, and currently support over 240 practices with Primary Sense across our region. And tonight we have had the lovely Kim and Michelle join us. So in conclusion, I'd like to thank you all so much for joining us for our webinar, which is What's Next for Primary Sense and How to Support Your CPD Hours. Thank you so much for your engagement and your questions. And a huge thank you to Juliet Schaefer from RACGP and Dr. Kylie Norris, who is one of our GPLO team members, for your presentation, your knowledge and your insight, and sharing that with all of us tonight. Once this webinar has finished, we encourage and welcome you to fill out the post-webinar survey. And as I said, it will help us plan and improve future education events, such like one like this. Our slides will be sent out along with any post-submitted questions and resources that we discussed tonight. And as I noted, this may take up to 2 weeks for it to be sent out. If after tonight, you have any further support that you may require, please get in touch with our practice support of how to utilize some of the reports or conduct a mini clinical audit or a clinical audit. We are more than happy to help support your practice with that. So thank you so much for your attendance and have a wonderful rest of your evening.
Good night.